Hi there, my name is viva. I'm an ENT consultant surgeon that works for the National Health Service in England. This video, however, is about how to think like a surgeon. I'm going to tell you 5 things. They get harder and harder, so you get more of the senior trainees needing the later ones. So let's get on with it. So this first section is about confidence. Now, you need an awful lot of this to become an excellent surgeon. If you remember, we're often in clinic, we're telling patients, I can take you or your child away, give them an anesthesia, make incisions, remove things or rearrange things on the inside, stitch them up, give them back to you, and they should be better than they were before. Now, that takes an awful lot of trust on the side of the patient, but you need an awful lot of confidence in your own ability to be able to say that to people. So it doesn't just happen in clinic, it also happens in theatre as well. So for example, can I go around this way and risk this vessel, or should I go around this way and risk the nerve? Or can I see enough here, or do I need to make the incision larger? Do I have enough room to see? So all of these questions, all of these decisions you have to make, you require confidence in your own ability to be able to make those decisions. So an awful lot of junior doctors say to me, look, I just need to do this operation a few more times and then I think I'll have more confidence, then I'll be able to do the operation better. I'm afraid it doesn't work that way. You can have lots of ability, but if you don't have confidence, you seem to get stuck and you can't move to the next stage. However, although that's not very good in emergencies and you're getting frozen, you can't do anything, it's preferable to being overconfident or having an overinflated opinion about your own ability, because then you go into overconfidence and arrogance, and that is frankly dangerous. So if you're the sort of person that needs an awful lot of help to get them through an operation, or you're the sort of person that seems to make lots of complications, lots of injuries, lots of damage, well, therefore, either you don't know the operation well enough and you should not be doing the operation, or you just have a confidence issue. If you have a confidence issue, you need to have an accurate knowledge of how good you are at something and to have insight into your own abilities so you can calibrate your confidence. Now, that's quite difficult to do. It's a skill to know how good you are at something, particularly something as complicated and as frankly risky as surgery. As a junior doctor, you end up watching lots of people operate, and then you can start comparing it to your own operations. Knowing how good you are compared to all the other people you've seen is really, really important. If you can videotape them and compare that to your own videos and sit at home and really carefully go through, that's really useful. The other thing you should do is get your surgeon or your attending, whoever the person is that's training you, to be really critical in how you operate. It does hit your pride, but you need to know this. So if you thought, oh, the operation I think went quite well, when in actual fact your surgeon goes to you, look, I think you did really badly here, you did badly here, and just get them to be as scathing as possible, because that will help you calibrate your insight into your own ability. If you have the right level of confidence, if you're not underconfident, you're not overconfident, you'll find suddenly that your consultant or the person training you has more confidence in letting you operate. If they feel like, oh, look, he's a bit overconfident, I need to drag him back a bit, or he's really underconfident, it's taking too long, I have to take them off. If you have the right level of confidence, you end up progressing through operations quicker, you end up learning quicker as well, because you get more experience. So this next section is about clarity of thought. Now, what I want to emphasize here is that you must have a reason, a clear reason for everything you do. So for example, if you're in clinic and you're sending someone away for a test or a scan or something, think to yourself, how is that scan going to help that patient, this patient who has to traipse around the hospital trying to get these scans? How is it going to help them? How is it going to change your management when you're looking after this patient? Because if it's not making a difference for this patient, then why are you doing it? Why are you wasting this patient's time? Having a clear idea of what you're going to do is really important. So another example is when one of my trainers said to me, I'll give you some practice for the exam. And she said, oh, a simple question about grommets. I said, okay, tell me, what grommet do you normally put in? I thought, oh, well, put a Shah grommet in. And then she said to me, why? And I thought to myself, why am I putting a Shah grommet in? It doesn't make any sense, because I don't even like the grommet. There are much better grommets out there. Everyone uses it, and that's the one that everyone gives to me. But why don't I use another grommet? I just suddenly realized I was blindly following what other people were telling me to do, and that's not the sort of surgeon I want to be. There are great surgeons out there. For example, Mr. Liam Flood, who I think some of you have met before. He's an amazing surgeon. I think he's retired now. The reason why I think he was amazing, one of the reasons why he was so amazing, was that he was so clear in his thinking. If you asked him something, he'd have a very clear plan, and it just made complete sense when you spoke to him. You think, oh God, if only I could be half as good as him when I'm a consultant. I need to ask him. And when you meet people like Liam Flood, who was so good, it's really inspiring because he makes you want to feel like, oh, I wish I was as good as him. Learning to think that way and being so clear really helps people when you're trying to aim to be a surgeon or you're training to be a surgeon. Why do I think clarity of thought is important? Because, for example, in clinic, if you're sending someone away for a test, you explain to them, look, this is why I'm doing this scan. If it comes up with this result, then we're going to do this. If it comes up with this result, we'll do this. And these are the reasons I'm doing the scan. And they're much more likely to understand it and appreciate why you're doing this, why they're having to go around the hospital. That's really useful because then you build trust with the patient. Another thing why it's useful is when you're in an emergency, you need to have clarity of thought. You need to think quickly, you need to get on with it and fix things. You don't have time to mull things over. Obviously, it helps also in exams because that's the sort of question people get asked. Why do you do this? Why do you do that? What's the purpose? What's your thought process? All these sorts of questions come up in exams, and that's what you really need to know. So how do you train yourself in clarity of thought? Well, one way is to, whenever you see a patient in clinic or in the emergencies, I'm going to ask my consultant what to do, but I want to have a plan before I go and see him. So I know what I would do if he wasn't here, and I just check that his plan isn't different from mine. If it is different, you think to yourself, right, why is it different? And maybe just ask, I thought this would be your answer, but you've chosen this. Why have you done that? And then the more you understand the processes, the reasons why we do things, the quicker you'll progress through your surgical career. Another way to do this in theatre particularly is if you're watching your attending or consultant, what you ever call it in America, if you watch him operate, try and predict exactly what he's going to do next. If you can predict what he's going to do, I think he's going to go around here and protect that nerve, or he's going to expose this area here. If you can predict every movement he makes, then you're halfway there to try and working out his decision-making process. You understand what's going on, and that way you'll learn more, you'll progress much quicker. As you get further along in your career, you'll notice that there are some operations you can do rather well. What I want you to do is always think to yourself, how can I make that operation any better? Aim for perfection in everything you do. Now, you will never get to doing a perfect operation. There's no such thing as Plato's metaphysical operation. We can't achieve that. It's impossible. So what you should do is always be highly critical of everything you do. Think to yourself, oh God, how quickly did I do that operation? Was there any bleeding? How's the scar afterwards when you follow them up? It should be invisible. Why is it not invisible? What did I do? Was that stitched in the wrong place? So if you become rather good at something, you might have to start videotaping yourself. Videotape your hands, your movement, your posture, the operation itself. Then you can see, look, actually, my hands were moving around too much like they do now. Stick to economy of movement. Try and be as coordinated, as measured, as controlled as you possibly can. It's a bit like those Japanese tea pouring ceremony things. It all looks very measured and purposeful when they do it. And that's what you should strive for. And the more you push yourself and drive yourself to getting better at a certain operation, even if it's very easy, even though everyone says, oh, you can do that now, the more you do that, the better the surgeon you'll be, the quicker you'll learn. All sorts of things that I think will improve if you carry it on this way. Often at medical school, we're taught, if you see this condition, this is how you treat it. Now, that's great. But as you get on, you start realizing actually everyone is treated slightly differently. Listening to what the general practitioners say, they say that every patient has their own ideas, beliefs and expectations. And you should treat patients in accordance to that. And I think that's really important advice, because what you've got to move away from is from treating the condition to treating the patient, because not everyone's the same as you. So a lot of people use the old Bible Leviticus verse, do unto others as you would have them do unto you. And that's great. You're looking after people as well as you want to be treated yourself, but not everyone thinks like you. And so you may think, oh, I'd do an operation for this. I'd want to have an operation for myself. But actually, everyone is slightly different. And your job as a doctor is to try and work out what drives that patient, help them through that process. You're not telling them what to do. We've moved away from a paternalistic urge that you have, oh, this is what you've got to do. This is what I learned in medical school. Do this, and then I'll treat you like this. It shouldn't work like that. They're coming to you as a consultant. You're consulting with them. You're just giving your opinion and helping them through because you know more about this condition than they do. So try and suppress those urges of being paternalistic and tell them what to do. You're not a dictator. You're helping them through and guide them through how they want to be treated. And having a skill in working out what drives them, what fears they have, really helps in this situation. At one point in your career, you'll start doing rather long operations, maybe 4 or 5 hours at a time. And during these long operations, you'll notice that you'll start dipping into like a zone state, or I think some people call it a flow light state. It's really, really useful. You get into a state where you're very, very focused on what you're doing at that moment. You don't realize it, but later when you watch your videos back of what you're doing, you suddenly go a lot quicker in your operation, much more purposeful and a lot safer as well. You're so hyper aware and so focused on the areas around you, what you're needing to do. I think the musicians and athletes use it a lot. I don't think surgeons use it very much at all. But if you can even use a little bit of it, it does help. Now, there are several ways, I think, of getting into the flow state. I think I've noticed when I started learning how to tie sutures very early on in my career, and I'd sit there in a quiet room, suture, 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 making my movements as purposeful, as accurate as possible, and then going quicker and quicker and quicker. It seems like these sort of repetitive movements and these repetitive sort of difficult processes seems to help you drop into this sort of zone state. Although I don't do this anymore. In the past, when I was doing gut surgery or colorectal surgery, we did 3-layer sutures to bring the gut together. I think these days everyone uses staples. Those sorts of sutures going all the way around, and then the next layer, and then the next layer after that, that helped me drop into this state. When I did cardiothoracic surgery, when you're tying in bits of vein from the leg into the heart, you have to make every suture exactly the same length, exactly the same distance, exactly the same pressure, so there's no leak around that vein. All of these things help you drop into that sort of state. So using this in an operation is quite difficult because you'll tend to fall in and fall out of the zone rather quickly. So one way to improve your chances of staying in the zone is to avoid as many interruptions as you possibly can, because that just pulls you out. At the start of an operation, just tell the nurses to open all the things you need for that operation. If you need a drill, open it up. If you need a stapler gun, open that up, because what you're trying to do is minimize the number of times you have to wait or interrupt in the middle of the operation. If you're having to wait, you just fall out of the zone. You have to start all over again. So another thing you can do is to try and help yourself drop into the zone again. Have a sort of process that helps you drop back in. I do an awful lot of ear surgery. So what I do is with my microscope, I zoom right out and defocus. And when I want to drop back in, I slowly focus in and slowly zoom back into the ear to that tiny little point that I was on before. It's a bit of a waste of time, but if it gets me into that zone, I know I'll operate much quicker and much more safely once I'm in that state. And it works beautifully once you get it right, and you can do this reliably every time. So the last thing I want to say before signing off is that be prepared for surgical training to be really, really difficult. It's tough to keep going. You'll find at times that you just want to give up. You'll find that people and events seem to always try to destroy your career, but just keep going. It's really, really important, because at the end, you've got an amazing career. It's amazing being an independent practitioner. When surgery just falls into place and it just clicks with you, you just wouldn't want to do anything else. And lastly, if you found this video useful, please do subscribe, because I've got more videos like it coming through, like how to make notes, how to revise, how to pass viva exams, etc., how to do better in theatre, how to learn operations quicker. And hopefully they'll all be useful for you.